Hello, my name is Ryan Leeming with the Western Washington University Outdoor Center, and today I'm going to talk about blister treatment and prevention. Alright, so before we talk about how to treat a blister, we're going to talk about how to prevent blisters altogether. It's much easier to prevent them than treat them, so if you can avoid getting them at all costs, then you never have to worry about it. First, you want to make sure that whatever you're wearing on your feet fits right. Make sure they're not too big or too small. That can definitely be a huge factor in getting blisters if your foot has a ton of extra room to kind of slip around in there and cause all kinds of unnecessary friction. We want to avoid that at all costs. So a pretty common mistake is not breaking in your shoes before you go on long hikes with them. So, say you show up at an REI, pick up a brand new pair of hiking boots, they feel great walking around the store, show up at a trailhead ready to hike 20 miles, and 3 miles in you got blisters all over your feet. Super common. You need to definitely break in your shoes before going on long hikes with them. So maybe that means wearing them just around the house to school for a week or two to really get them broken in, see how they feel when you've been wearing them constantly. Because while wearing them in the store can kind of give you a good idea of how they'll feel, they don't really give you a good idea of how they'll feel long term. So definitely make sure you're breaking in your footwear before using it on long distance hikes. Another super important thing is making sure that your socks stay dry. Having wet socks definitely increases the friction between your socks and your feet, so having a ton of extra pairs of socks is always a good idea. Don't weigh much. It'll definitely keep you very comfortable. No matter how waterproof your shoes are, one thing that they all have in common is that they still got a big hole right in the top. If you're walking in a wet environment against a bunch of underbrush and stuff, they'll get wet pretty much no matter what if you hike long enough. So bring lots of extra pairs of socks. Anticipating that your socks will get wet is always a good idea as well. Another thing that some people like to do is liner socks. There'll be a super thin pair of socks that goes under your hiking socks. So that kind of means that if they're tight enough against your foot, then they're not going to be sliding, causing friction with your skin. Instead, all of that sliding will happen between your liner sock and the sock on the outside, your hiking sock. So that can help kind of alleviate some of the pressure too. You also want to make sure that whatever socks you're wearing are not cotton. Cotton will kind of hold on to all that water and it'll make it extremely hard to dry out. You want to make sure that you have some wool, polyester type socks that'll kind of wick sweat away from your feet to kind of reduce some of that friction even more. Also, a pair of sacred socks to wear just when you sleep is a good idea. You never want to sleep in wet socks. Always keep a pair of dry socks that you never wear during the day, so you always have some dry socks to sleep in. So say you kind of hike, you do lots of things, maybe you ski a little bit, you know that no matter what you do, you will get blisters. There's some specific areas that everybody kind of has that are very high friction, and say you just get blisters super easy. There's a couple things you can do to kind of anticipate that. The first is kind of just taping around your foot. So just take some athletic tape, and just kind of tape around all of the areas that are high friction and that will get a blister. A pretty common one is like on the back of the heel. So just put some tape on that is a great way to anticipate it. Another great way to anticipate blisters is with duct tape on the inside of your shoes. They make these things called Engo patches that are specifically designed for this. But if you don't have those, duct tape works pretty well too. So what you can do, say I know that I get blisters on the back of my heel kind of right through here. I could just take a piece of duct tape. It's nice and slippery on the outside is exactly what we want. And then if I just kind of stick this to that spot, it's going to kind of create a slipperier surface here to slide around on and kind of cause less friction with my foot. This can kind of be done everywhere, sometimes people get them on the bottom of their feet, so you might just put one on the sole. But that's another good way to anticipate and prevent blisters. Alright, now sometimes before you actually get a blister, you'll get something called a hot spot. This is kind of your last chance to prevent a blister from happening by addressing this immediately. Sometimes it's kind of hard. You're on the trail to start feeling that. It's kind of like a heating sensation. You kind of pull over immediately It's kind of hard to kind of get yourself to do that, but if you want to avoid a blister, you definitely should just stop what you're doing, pull over on the side of the trail, and address that. Something to kind of do then would be to try to add some sort of sliding layer, again, between your skin and your sock, or between your sock and your shoe. So if that means duct tape on the inside of your shoe, or duct tape kind of over the hot spot, as long as it hasn't developed into a blister yet, that would be okay. But just kind of try to address that immediately, and don't let it develop into a blister. So now we're going to talk about what happens when you do get a blister. What we kind of have here is a bit of a prop. It's just a silly Halloween decoration. It's like a severed leg type of thing. But I've actually taped a piece of big bubble wrap onto the back to kind of simulate that, and kind of colored it in red just to make it a bit easier to see there. So this is what we're going to be using to kind of talk about how to treat blisters. It's just a bit easier to see than try to doing it on my own foot or just talking about it. So this is going to be our little prop for this. Alright, so first we're going to kind of talk about some of the things that I generally like to keep with me, you know, in a medical kit or backpacking, just to kind of address blisters. So we have lots of different kinds of tape here. You know, duct tape is great. It's kind of slippery and definitely sticky, a bit more waterproof. So great to put on the inside of your shoes or over a blister. Not directly over it, of course. You never want to put anything adhesive over the top of the roof of a blister, because then if you take it off, it's just going to rip it off, and that's not what we want. So duct tape, again, I mean, it's incredibly useful for a bunch of different things, so always good to have. Athletic tape is definitely super stretchy. I like to put this, if I have like a band-aid over the top of a blister, I would kind of wrap this around the rest of my foot, just to make sure that band-aid stays on. Generally, blisters are going to be in places that band-aids won't just stick to super nicely, so you really want to kind of add something else to keep whatever dressing you put on your blister in place. So I like to use athletic tape for that. And then this we have is some blister tape. Now this stuff is stretchy. It's actually pretty puffy too, so it kind of adds a bit of padding over the top of a blister, which definitely helps to kind of ease some of the pain that comes with like the friction and pressure on a blister. So I definitely add this to any sort of dressing if I wanted to add a little bit of extra padding. So, you know, anything I say here, you always throw in or substitute blister tape as a way of padding it if it's more painful. Something else we have is Moleskin. It's kind of a felt pad that's a little bit more slippery, and is also padded kind of like the blister tape. This is a great substitute for that. You'll notice that a lot of times will come pre-cut out, and you can kind of get these little donut things. Don't really want to waste this, but I don't know if you can kind of see it. There's like a ring of stuff that you can kind of peel up there. You would kind of want the blister to be in the middle of that. Again, so the adhesive is not actually on the blister, so if you take this off, it's not going to just rip off the whole thing, but it'll add some kind of padding around the outside of the blister. Band-aids, always good to have an adhesive with a pad in the middle already kind of for you there. There's kind of two different types. There's the island and normal band-aids. So an island band-aid is any sort of band-aid where the pad is actually completely surrounded by adhesive, and that stops any germs from the outside of getting under that pad to whatever's underneath the band-aid itself. Just normal band-aids that aren't like that are fine to use as well, but you do want to make sure that you kind of make it into an island bandage by putting some sort of tape over the back of this to kind of make the whole thing surrounded by adhesive again, so stuff isn't getting in under this pad to what you're trying to cover up. Alright, this is Aquaphor. It's kind of like a Vaseline thing that actually helps kind of repair skin, and kind of helps the healing process. You always want to keep blisters kind of moist, if that makes sense. You never want them to dry out. If it scabs up, that's not actually healing. that's just kind of covering it up, and that scab's going to come off and just reveal all of the raw stuff underneath it. So you want to keep it kind of moist, and like a Vaseline is definitely the best way to do that. I like Aquaphor. But yeah, definitely want to put a layer of that over the top. Should always have like a clothespin or something, lots of different reasons, but definitely a good way to poke a hole into a blister and drain out the fluid if you need to. And then a lighter, if you want to sterilize it, is not a bad idea as well. And then the last two things here are some sort of antiseptic. I just have hydrogen peroxide here. But if the roof of a blister comes off, it's definitely prone to infection. So you definitely want to put some sort of antiseptic on that before you cover it up with a bunch of stuff. Liquids are definitely nicer because then you can just kind of pour some over the top of it. You don't have to take a cream and like rub it into the blister. That definitely doesn't feel good. And then this stuff, which is Moleskin. It's kind of like a liquid bandage that has an antiseptic in it. So if I get a really kind of bad blister, I would kind of take this. There's just a little like brush on the end of it, and paint this over the top of the like the raw blister, and it would kind of add a bit of a protective layer and also sterilize it because it also has an antiseptic in it. Definitely stings quite a bit when you're putting it on, but I like to use it. Alright, now how you treat a blister is kind of dependent on two different things. Where you are and what you have to do over the next couple of days, and whether the roof of the blister is completely intact or not. So for this example, we're going to say that we're just, completely at home. Maybe we've just gotten back from a hike. We're at home. Going to be home for a couple of days, not really needing to do anything. What we actually want to do is just completely leave this alone. It is definitely super tempting to pop this, but the best thing to do at this point is just leave it alone and let it heal itself. As soon as you kind of open the whole thing up, the risk of it getting infected definitely becomes an issue. So maybe wear some footwear that doesn't rub against it, or just kind of walk in a way that doesn't put pressure or friction on it. But we're going to want to just let this kind of heal on its own if we're at home. Now the next example here is what we would want to do if we were on a day hike. Maybe we're 6 miles into a 12-mile hike for the day, and we're going to be home at the end of the day, but the pain is really bad and we want to do something about it. And we also kind of want to keep most of this intact, again, to reduce the risk of getting an infection. So it kind of makes sense, right, that a filled up balloon is much easier to pop and tear than a completely deflated balloon. So to kind of stop this whole thing from just tearing off and exposing all of the raw skin underneath, we're going to want to drain this. Now to kind of keep this from getting super infected, we just want to make a tiny puncture and then just kind of press it to drain all of the liquid out. That's going to make it a lot harder for the whole thing to completely just tear off when it's stuffed in your shoes. And it's going to make it also a lot less painful by relieving some of the pressure. So we want to do this in kind of a sterile way. I like to generally use a paper clip just because I always, generally have one on me in a first aid kit or whatnot. And then it's not a bad idea to kind of just either, dip this in some antiseptic, hydrogen peroxide or something, or also just kind of get it a little bit hot just to make sure that you're not, filling that up with a bunch of bad stuff. So, just kind of like this, maybe get it a little bit hot here just to burn off some of that bad stuff. We don't need it red hot, we don't need to burn ourselves with this thing. But what we're going to do is we're just going to kind of come right close to the edge of this thing, and then just put a tiny puncture hole in there. From that point, we can kind of push out all of the air to kind of get this thing flattened down. Again, most of the roof is completely intact, but all of the air and liquid is out. Over time, this is actually going to kind of like fill back up again, and then that little hole will kind of heal. So you just kind of want to keep doing that if you're out for a very long time, and this is how you're choosing to address the blister. At this point, the skin will be super easy to just tear off if it does end up just getting shoved back into a shoe again. So we want to cover this up somehow. A great way of doing that would be a Band-Aid. with some stuff over the top. Now, normally you probably wouldn't have a blister quite this big, and we'd have a Band-Aid that maybe be a bit bigger, but this will do the job for this thing. We want to put the pad, of course, over the blister itself, and then stick that right on top. Now, again, this will come off super easily if we just shove this back in our shoe and continue on with a pretty strenuous up and down kind of hike. So we want to put something over this to make sure that it doesn't just come off. I like to do just a bit of duct tape, maybe to make it a bit slipperier. And then what I would actually do, if you're somewhere where you really want this to stay on and don't want to have to keep messing with it, would be to kind of take some athletic tape and just really get it to stay there. So that up. I would do something kind of up and around the top of the foot like this. And then just go kind of all the way around, right like that. Get that all stuck down. This is going to definitely help this to stay on there, especially this is kind of moving, doing all sorts of funny stuff that's going to make it hard to stick. So really keeping something down like that is really the best way of doing it. But from kind of this point, you really want to make sure that you're not getting bad stuff in there and not letting it get any worse. So maybe take this off every night when you get to camp. If you're on a multi-day hike, or if you're on a super long hike, check it a few times and just make sure that it's not getting any worse. Maybe reapply the bandage or the tape if it starts to come off. Alright, so the next case we're going to cover here is if you get a blister. The roof is still intact, but you are on a multi-day hike. And you need to kind of continue that hike. Now, leaving the roof kind of intact and just poking a hole in it might work for a little while, but inevitably that whole thing is going to get ripped off. It's kind of impossible not to. If you're, in the middle of a 80-mile hike, you're not going to be able to just kind of make sure that roof stays intact. So the best thing to do at this point is to remove the entire roof, and then just kind of cover it up on your own with something more durable that isn't going to kind of come off. So, any sort of like a knife or scissors is kind of the best way of going about that. Again, not a bad idea to sterilize it with a lighter or hydrogen peroxide, just to kind of make sure you're not immediately getting bad stuff in there. And then, we're going to kind of just carefully cut right along the base of this to remove the roof of the blister here. Alright, so I'm going to go ahead and color this in here, just so you can kind of see where the base of the blister is, because it's kind of clear, hard to see. So it's right there. I don't know if the glare is a problem at all, but just that red spot. What we're going to want to do here is definitely make sure you sterilize this with something. So again, my go-to would be liquid skin. So I would go ahead and take that and then just kind of paint it on here. Again, definitely does not feel good, but acts as a a way to, like an antiseptic, but also a way of kind of adding like a little bit of a protective layer over the top. Next, what I would do is I would take Aquaphor or some other kind of like lubricating agent, like a Vaseline or something, and just kind of take that with your fingers, get a little bit on there, and then you want to just rub that. Don't really need to rub it in too much, but just get some in there so it won't dry out. Is also going to help it heal a little bit more. set that to the side. And then what I would do from that point is apply some sort of pad. So that could be a Band-Aid or a bit of like gauze, or they make these blister patch sort of things that'll kind of work good for that. But some sort of pad. For this example, I'm just going to use a Band-Aid. Just a normal Band-Aid here again, so we want to make sure that we add some sort of adhesive all around this so that stuff doesn't get in underneath this pad, especially now that this whole roof is off. Definitely prone to infection. So we want to just kind of put that, make sure again just the pad is over the top of the blister. Put that Band-Aid over the top. So again, from that point, what I would do is probably, this is going to be pretty painful, so I would add some sort of Moleskin or this blister tape that I really like over the top of that to kind of give it a little bit more like puff, I guess, to kind of get rid of some of that pressure. So I would get quite a bit here, just so it's not going to come off quite as easily. Just stretch it out and let it grab on there. All of this stuff will stick a lot better to your own foot instead of this sort of latex or whatever this foot here is made out of. But that'll add again a little bit more like puff so that the pressure isn't quite as bad on the blister itself. And then we want to make sure this whole thing kind of stays on. So I think at this point I would use either athletic tape or duct tape to again wrap this kind of around the whole foot here, because you really don't want to have this coming off like all the time. And if you're hiking and constantly moving and using your feet, it definitely will. Again, don't wrap this too tight around your ankle. Don't want to cut off any blood flow, but just want to make sure that this whole thing is kind of staying on, just like that. So this is kind of what that looks like. Again, you want to make sure you kind of check on this maybe every day or every other day, just to make sure that it's not getting infected, and maybe to replace it if it's gotten super dirty. But yeah. Alright, so that about does it for blister treatment and prevention. I hope your blisters are kept to a minimal. Definitely a quick way to make any sort of fun experience super painful. So yeah, definitely, you know, a little bit of forethought can go a long way in preventing blisters altogether. But then if you know you do get a blister or a hot spot, definitely try to treat it immediately. But yeah, I hope that everybody enjoyed themselves or learned something, and I hope to see all of you in the future. Have a fantastic rest of your day.